a good plan, you need to have a good policy framework, exactly as you mentioned. And
in what sense?
To build a policy framework and to make it simple, it means that you have a clear strategy on what you want to achieve through the presidential initiative. The multidisciplinary team assigned to the presidential initiative wrote down what they need from resources perspective, for example. And from resources, it means that the policy framework must define the human resources we need for success. We need to train the healthcare professionals, the physicians, on how to diagnose, on how to read results. We need to train nurses. We need to train individuals who are going to just take the key demographics of the patients and register them on the system. We need as well a good technological resources. We need a good IT infrastructure. Hence, there were a platform implemented for the presidential initiative where patients can actually put their contact detail, and then they will receive a contact SMS message to go and make the lab test. They will go for confirmatory test, starting if they are positive to take the treatment or another actually platform. And the central location in the Ministry of Health will be able to aggregate data, generate insights, and they can track cases day after day. We need as well for resources, a good financial resources. We need to have a very good tools in terms of medications, and hence Egypt started to communicate with the local plants here in Egypt to manufacture all the treatments to be made in Egypt. And that was another actually news to celebrate, that all the treatment for hepatitis C is actually locally manufactured by Egyptian manufacturers. And the screening tools, we need to purchase screening tools with the most efficient price, the diagnostic procedures, and the monitoring tools as well.
But the medication was manufactured?
The medications, all of it, 100% of medications were actually locally manufactured by Egyptians.
So this is the first time in Egyptian history that we manufacture this hepatitis C medicine, right?
After Sovaldi, exactly after Sovaldi. Before Sovaldi, there was no Egyptian medications. It was all except for a very minor production from a local company, and it was not that successful.
And that's
after
why
Sovaldi,
it was a big hassle.
Very expensive, big hassle. After Sovaldi, a couple of months, in less than 1 year, the Egyptian manufacturers started to manufacture the medications, which is same efficacy like Sovaldi. We are talking about medications with a 97 to 98% success, which is a very high percentage.
Amazing.
And once you do have the resources, the financial, we mentioned human resources, we mentioned financial resources, technological resources. We do have currently the diagnostic, the treatment, the monitoring tools. You need to have a good processes. And that's the second thing in any policy framework. How can I make sure that the patients are going from their homes or the subjects to get screened, to be screened? If positive, how are they going to actually go to start their treatment? And if they're going to go to start their treatment, you need to make sure that they complete the course of treatment and there is a positive outcome. Hence, you do need a call center, and a call center was established. We're going to call the patients to follow up. All these steps are done, and if the patient drop out and he didn't go to get his treatment, they're going to call him, and that actually happened, and tell them, please, you do have a dose, the treatment is for free, everything for free. Make sure that you continue your medications to make sure that you eradicate the virus from your body. And after the call center, they receive all the treatment and their data will be on the system. And hence, the most important part in the policy framework is the outcome. How can I make sure that I do have a good research infrastructure, that I can track the clinical outcome and make sure that I am actually tracking and tracing every single patient on the system itself to make sure that I reached a success factor which is beyond the benchmark I'm actually seeking. And talking about that, you mentioned the gold tier, for example.